Things were back to normal at the Petco Park Vaccine Superstation today, the partnership between the county, UC San Diego Health, and the Padres working to get vaccines into the arms of the more than 600,000 healthcare workers in the county. On Wednesday morning, the operation here slowed to a crawl after 6 people experienced allergic reactions.
It was just the clustering of them together that led them to do I think a great slowdown to be able to assess the situation.
We checked with the county to see if they've been able to determine what was behind the cluster of allergic reactions. They emailed us a brief statement saying, "We have not seen a report with specifics on what occurred, so are unable to comment further." And they pointed out that the FDA and CDC are the primary investigating authorities. San Diego dermatologist Dr. SEAVER soon knows all about allergic reactions. He says if you've had allergic reactions to vaccines before, you should talk to your doctor before getting the COVID vaccine. He says immediate reactions like the ones experienced at Petco are potentially the most dangerous, but
if you have kind of these delayed reactions like, fever, general wellness, body aches, those for me, those are manageable and allows you to get immunity.
Healthcare worker DEBORAH Walsh has really been through the ringer when it comes to COVID.
The next day, though, I woke up and I had chills and body aches pretty much most of that day.
Walsh first contracted and then recovered from the virus last summer. Then, on December 30th, she got the Moderna vaccine, the same one being given out at Petco.
No fever, but just felt pretty bad, and I was pretty much stuck in bed all day.
Then, on New Year's Day, Walsh says she woke up and felt just fine.
From what I understand, if someone has had a previous infection, that the immune response to the vaccine can be magnified. So that's what I got.
We reached out to Moderna for comment, but no one returned our call or email. Meantime, Walsh says she's preparing herself for the second dose of the vaccine she'll get next week. She says she's already taken the next 2 days off after that to recover. But even with what she's been through, she still has this piece of advice.
I think everyone should get vaccinated.
And this bit of reassurance from Dr. Soon.
Allergy to vaccines is not a very common event.
While the county works to figure out what's behind the allergic reactions at Petco, the cost-benefit analysis for the vast majority of us seems clear. When the vaccine becomes available, we should all get it. John Carroll, KPBS News.